Well, Vermont reported a record today, 487 COVID cases. In fact, it was the highest daily count since the start of the pandemic. Local 22's Devin Bates joins us in the newsroom tonight with reaction from state officials and more about really what this could mean going forward.
Yeah, Lauren, Vermont also reported 6 COVID-19 deaths today, and there's a palpable sense of concern from state officials about how many of these cases could soon become hospitalizations. It was a day that broke records in Vermont for all the wrong reasons. 487 COVID cases, well over 100 more than the previous daily record.
After a period of kind of fluctuation where they had been pretty steady, showing signs of decreasing, showing signs of increasing, we've had now 3 or 4 or 5 days of increasing cases, including this large day today.
With 6 of Vermont's 14 counties reporting over 40 cases, I asked Department of Financial Regulation Commissioner Michael Pichek if Thursday's numbers are a warning sign for what could be a dangerous holiday season.
Just look back a year ago, last November, our cases went on the rise. A lot of that was connected back to Halloween. We're only a few days out of Halloween. We're already seeing our cases start to increase.
In a statement, Governor Phil Scott said in part, quote, "We believe that if all Vermonters band together to make smart choices in the coming weeks, we can make sure that today's uptick is not a trend that drives greater hospitalizations and deaths. But it takes all of us stepping up and committing to those smart choices, starting with getting vaccinated if you have not done so." Based on current rates, the uptick in cases could have Vermont reaching 80 active hospitalizations in a matter of weeks.
What we're most concerned about is hospital capacity through this whole period in time. Elevated case counts like we're seeing from today would make us concerned about the strain that's going to put on our hospitals over the next few weeks.
UVM Medical Center recently created space to add 8 extended recovery beds and 12 inpatient beds. The hospital's director of nursing and operations resources said having that kind of flexibility is important.
We have a good plan in place to make sure we've always got a few beds ahead waiting if we have COVID patients need to come into the hospital. This just gives us more flexibility in our system to be able to continue to let people who don't have COVID get access to the healthcare they need.
And the governor also mentioned tonight that he doesn't want Vermont to have to take any backward steps with the state of emergency, and said today's data underscores the urgency for parents and caregivers to sign their children up to be vaccinated if they're eligible. Reporting in the newsroom, Devin Bates, Local 22 News.
Okay, Devin, thank you.